สวัสดีค่ะ Good afternoon. Welcome back to Health Dialogue by BDMS. Today we are here with our cardiac interventionist, Dr. Watanyu Prainate.
Good afternoon.
So why we are here today, and special why we have to talk to interventionists today regarding on 29th of September, it's the World Heart Day, and this disease is really, how to say, it's kind of one of the things as people worry. And the topic today is balloon angioplasty, and we're gonna know the benefit and the risk from our doctor, Dr. Watanyu. So good afternoon, doctor. So we would like to know more details about balloon angioplasty or coronary artery disease. So how is this disease, and why so many people get this disease and how to deal with it?
Okay. May I talk about the cause of this problem or cause of this artery first? Okay. So
ขอเสียงหน่อยนะคะ
the slide is still.
We're gonna go to the second slide.
Okay. The cause of this problem or the cause of the coronary artery disease is there will be when we get older, or some people that have high cholesterol, they will have the cholesterol plaque that deposit at the arterial wall, and this will make more narrowing of the coronary artery, and sometimes there is some rupture of the plaque and cause some thrombus or clot that will acute block to the blood flow of the coronary artery that will cause acute heart attack.
It takes just a second to talk about that, but how long actually does it take to combine until we get that kind of things? A year or many years?
Some people will have for many years, but for the acute heart attack, it will happen immediately. When there is a acute plaque rupture with the acute thrombus or acute clot that block the coronary artery, because if there is cut of the blood supply to the heart, that will make chest pain or angina. You can see the left picture. There is a narrowing of the near the beginning of the coronary artery, and from the coronary angiogram you can see that the blood flow there is
it's not continue to the end of the road, right?
Yeah, it's like narrowing here at the pointer. Severe narrow. So this will cause not enough blood supply. Like some people when they run or they have more activity, they will get not enough blood supply to the heart muscle, and this will make we have chest pain or angina, and make heart muscle function not normal. The symptom that we have to think about heart problem or heart disease or heart attack. Some people will have chest pain or just some pressure or chest tightness inside the chest, maybe mid chest or left chest. Sometimes they have the pain radiate to left axilla, or their arm. Or some people will have like burning in the stomach or the heartburn or indigestion, like we call GERD or gastric reflux.
Oh, I heard that so many people think they have got GERD problem,
Yeah.
but sometimes it also can be hard.
Yeah,
Ah.
many people I found some people that actually they have gastric problem, stomach problem, but some people it's how do you,
Then they come to the heart center.
yeah, they have like stomach problem, but in fact they have heart problem
Ah, I
because
see.
the it's quite the symptom may be like stomach problem from heart people.
Oh.
Yeah, like
So they should not just ignore. So they should come and check.
yeah, because stomach problem will not cause people die, but heart problem will cause you the people die. Some people will have like asthma or more tiredness when they exert or when they work more harder. But some people said they are asthma. Actually, they are tired from heart problem. So, and the people that who have risk of the coronary artery disease, there are many factors that can cause heart problem like cigarette smoking, high blood pressure, high cholesterol, or diabetes, or some people that get advanced age, like male is more than 55 years old or female more than 65 years old.
Oh, why female have more room? I can breathe better. But anyway, there are many people who attend, like they're also smoker, they have hypertension, they have diabetes, and they are getting older. So that means more risk on
Yes.
that people, right?
Yes, and the the other important factor is could you please go to the
The
previous slide?
previous slide, please.
Okay.
Uh-huh.
Yeah, some people, especially for the genetic, if you have father or mother or brother sister that have acute that have coronary artery problem in the family, you should beware about the genetic factor too.
Oh, that's why sometimes when we come to the hospital and we do the annual checkup, and the nurse also asks us a lot of questions about the family history.
Yes. And some people that have high body weight or not exercise a lot, they may have to take care about this factor too. So we can prevent by modify the factor that I mentioned about, like
For example,
like stop
I should
smoking.
quit smoking if I am smoker.
Yes.
Or a hypertension, we can treat by the medication.
Yeah, we have to control the blood pressure to be normal or near normal, and control the food and medication to lower the blood cholesterol.
And also sugar level.
Yes, and control the speed, control sugar to make less blood sugar to be normal or near normal.
Okay. And manage the body weight.
Yeah, and more exercise.
Yes.
But if you think you have heart problem and you want to exercise, you have to fix heart problem before you start to exercise, because some people that have heart problem and they try to exercise, they will may have more problem about high probability for the acute heart attack.
Okay, so if I, for example, I am fat and I want to manage my body weight, should I come and have a check done first to make sure that my heart is ready for the exercise, right?
I think so.
Okay.
So, and how and if you come to see doctor, and if you want to find out if we have or the people have coronary artery problem or not, we can check many modality, many procedure, like more simple, the most simple but not but have less sensitivity is electrocardiogram, because
EKG,
EKG, because many people that have normal EKG may have hidden heart problem inside.
So EKG is one of the things that you have to do, but it's not just only one.
Yes.
Okay.
Maybe people have problem of the heart but have normal ECG too. the other, we can perform echocardiography
Mm-hmm.
from this movie.
Okay.
You
The videos, we should play the video.
ทำให้ภาพเคลื่อนไหวได้ไหมฮะ Yeah.
Okay.
From this video, you can see that the lower part contract quite fine, but the upper part
Is
at the
look-
pointer
Uh-huh.
has less contraction, has less movement.
Mm-hmm.
So that means this patient have some abnormal contractility
Condition.
of the heart. So maybe they have to check for his coronary artery because the blood supply to this part may have problem. The other test is treadmill stress test
Mm-hmm.
and CT scan for the coronary artery or cardiac MI stress test, and the most sensitive is coronary angiography.
So this means everything can be done in Bangkok Hospital Phuket, right?
Yes, all can be done here in Bangkok Phuket Hospital.
Okay. I know that some checks can be done at the heart center, but some has to be done at the X-ray department.
Yeah,
Imaging unit of
Yeah.
Bangkok Hospital Phuket.
that's right. And what is coronary angiography? The procedure that I do is the coronary angiography is a procedure that we put the catheter and inject the contrast to see how is the luminal patency of the coronary artery.
Yes, without contrast, we cannot see this detail, right?
Yes. So for the the first movie, you can see that there is abrupt cut off of the
Blood circulation.
blood circulation here.
Uh-huh.
The second and the third movie are the normal coronary artery from the angiographic finding. You can see that the lumen quite smooth and gradually taper and separate into the small branches. But for the first picture, you can see that the
Doesn't look fine as the second and the third one.
but it's abrupt cut off of the far part of the coronary artery. We can put the catheter from the femoral artery or from the groin or from the artery at the wrist of the radial artery.
So two choices.
Yeah, we can.
And our interventionist will make decision which part is suitable. For
Yes.
each patient, maybe not the same.
Yes. And this movie, I try to show the procedure that we perform, coronary angioplasty. It's an operation that we try to make the lumen of the coronary artery to be larger or bigger to make more enough blood supply. Or
It looks like the road is narrower and you have to make it wide, and the blood flow can go.
yes.
Okay.
So the first movie you can see at the bifurcation or the here, it's more narrow, and then after I put the balloon to open the artery, this will make the lumen bigger. This is the balloon open the artery, and after that I put the stent
Okay.
and make the artery become larger.
Okay. What we are talking about is something 1 millimeter to 2 millimeters.
Yes, about that. Some usually maybe 2 or 3 millimeter, but some people have larger, like 4 or 5 millimeter.
Are they lucky if they have wider one?
Yes.
For some cases.
So may I show some case that have acute heart problem
Yes.
and come to see me at the hospital. The first case is the old man, 80 years old. He come with acute heart problem. Previously, he have a chronic kidney disease and perform hemodialysis more for many years ago, about 13 years ago.
So he is facing that hemodialysis. He is doing the hemodialysis. That means he also has to has the station for hemodialysis
Yes.
weekly.
Yes. He perform hemodialysis 3 times a week.
Oh.
And he come with epigastrial pain.
Mm.
From echocardiogram, there is an abnormal contraction of his heart. So he was proceeded to perform coronary angiography.
Fast track.
Yeah, this is an how to say elective coronary angiography because he have off and on chest pain and feel tiredness. And from the coronary angiography, you can see the last picture. There's narrowing, diffuse narrowing of the coronary artery. Okay. Yeah. You can see narrowing here and here of the coronary artery, and also narrowing here at the beginner of this branch. At the beginning of this branch.
It's like the blood doesn't go through.
Yeah.
Right?
So this patient have severe narrowing of the both artery, of these two artery.
And that's called shed pain.
And also the other part, but because he has a lot of the many parts that have narrowing and high calcium, high calcification in his coronary artery. That is a high risk for perform balloon angioplasty.
So the decision for each patient is not the same.
Yes.
So you have to also see through his history and also his artery condition.
Yes. So in this patient, first time I advise him to perform bypass surgery because by the guideline recommendation for the people that have many lesion or high risk for the to perform angioplasty, we recommend him to perform coronary artery bypass graft. But because he feel he was old, and his relative, his son, his daughter, said he was old, so they all refused for bypass surgery. So in this case, he accept the risk for coronary angioplasty. And because this patient have high high risk and high calcium, I have to use the rotablator. This is a rotablator is a diamond coated drill.
Like drill, but how big is it?
It's about.
How small is it?
In this case, I use a 1.5 millimeter to 1.25 millimeter for this case. First time I try not to use this rotablator because there's risk of perforation from this device. So I try to pass the balloon first, but the balloon could not pass to the far part of the artery because it's stuck at the calcium. So that's why I have to use the rotablator after. You can see this like a cone shape. This is the head of the rotablator with a high speed drill, about 200,000
time spinning
time per second.
Okay.
And it will drill and say
go through, right?
Yeah, go through the artery. And then I open the artery and put the stent after.
Okay, with rotablator, it's like lead you the way.
Yeah,
you can put the stent into that artery.
It will make the lumen more bigger, make a more space because it will cut out the calcium.
Yeah, okay. So calcium is good, but not there. If you have calcium there, it's like plaque on your artery. It's not good.
So this is a final angiogram. The upper movie or before.
Okay.
And the lower.
So the three pictures above are before.
Yeah, and the lower
that is after you
or
treat.
the after treatment. You can see that the lumen is more smooth and more bigger than before.
And we see the blood circulation. We see the artery clearly.
Yeah,
Wow.
maybe this is too much movie, so there is some stuttering of the video. Okay, I will stop the video and allow just only one.
We play only one video.
Only one video. Yeah.
Okay. We freeze the other one.
Yeah.
Okay.
For the above, you can see that
it's like no root there. If it's the root.
Yeah.
Yes.
Above there is there was narrow and irregular, but the lower after we put the drill, the high speed rotablator.
Do you have to detect everything by your eyes?
Yes, and some people I use an ultrasound, intravascular ultrasound to put into the coronary artery to check the artery size.
Okay.
And put the stent after to make more proper size of the stent to the coronary artery.
So not just doctor eyesight, but also ultrasound to check.
Mostly I try to use ultrasound to
confirm.
To confirm and put the precise size of the stent.
So I'm sure that everything is by the high standard to make sure that we will give the proper treatment.
Yes. And after he performed the angioplasty, this patient have no pain after that.
I feel so good.
Okay. And the next case.
But if, let me ask you, if he is like coming a little bit late, how can be like 2 hours later or 2 days later? Can you still like?
I think the next case is an example for the people that have acute heart attack that should not be wait because we will lose patient if we wait. ขอใช้เมาส์นะฮะ This is a Danish male, 83 years old. He have epigastrial pain and he was diagnosed as acute heart attack. He refused for the thrombolytic because some people they will advise for thrombolytic that will lysis the thrombus and make opening of the coronary artery. But in this case, I think
he's soon enough because he's from Phang province.
Yeah, but before he come here about 12 hours, he didn't come immediately because of the long distance from that, and because first time he thought he had GERD, he have gastric reflux. But then he feel more pain, so he went to see doctor, and after that he was transferred to our hospital. From the angiography, you can see that there is a block of the beginning of the coronary artery. Other artery is fine. So the problem artery is this supply for the right side of the heart and the lower part of the heart. In this case, I could fix, but this is quite difficult. I used about almost 2 hours to open his coronary artery, but finally after I opened it, he become no more pain.
You know, every time I see the presentation of Dr. Watanyu, when he showed me the before and he start playing the after video, I feel so happy that the picture like that happened. It's
Thank you.
One person life. You save life almost every day.
Usually my case quite more than half usually like a acute heart problem that we have to correct it as soon as or fix it as soon as possible to save the people's life. But the other are the how we call the elective case.
Yes, can be wait.
We can be wait. They can be wait. Yes.
by experience, let me share. Once we have tea talk in our hospital, at that day, I also invite Dr. Watanyu to be the speakers. And you know what? On that day, we have like emergency case step into the hospital, refer to our hospital, and even the talk gonna start in a few minutes. But our doctor, patient first, he made decision, and everyone sit and wait for him, nice and calm. But we know that Dr. Watanyu is going straight to the cath lab and taking care of one life. So at that day, we've been waiting about an hour, doctor, but everybody sit nice and calm, waiting for you. And we know that what you are doing, you are saving lives. So we
Thank
know
you.
that. But after that event, after he saves one guy's life, he came to our meeting room and explained to us about what he has to talk an hour ago. Like he can manage everything. I think on that days, instead of feeling like boring, waiting for you, we feel so excited and we are waiting to listen to you. And everyone who wait for you on that day, they are happy
Thank
that
you.
you show up and tell us the story. And today again, he shares the story like this. We go to the case number 3.
I think this is the last case because we have limitation of our time. This
Uh-huh.
is the third case that the people have acute heart attack, and this is an example for I use the radio approach. That means I perform
by
cardiac
the
cath
by the wrist.
by
Yeah.
the wrist. Yes,
Uh-huh.
but we cannot use the wrist approach in all the case because some people that have chronic kidney disease that need for chronic hemodialysis,
Mm-hmm.
we have to spare or save the artery of the wrist for the
Oh yes,
procedure.
yes, yes. Because they have to do that kind of hemodialysis maybe 2 or 3 times a week.
Yes, and some
Uh-huh.
people that have cardiogenic shock
Mhm.
or cannot palpate the pulse, we have to do by the groin.
Okay.
This is a Chinese male, 80 years old.
Mm-hmm.
He have chest pain radiated to his left jaw about 4 hours before admission. And after he take nitrate sublingual, he didn't feel improved. So he came to the hospital. Previously, he was fixed his coronary artery with the stent before from China. And from the angiogram,
But not at the same station, right?
yeah,
Mm-hmm.
he will fix the stent at from China in some artery before. And from the angiogram, we can see at the beginning of the branch สไลด์ไม่ค่อยเล่นนะฮะ ผมไม่เห็นเมาส์ของผมเลยเนาะ at the beginning of the branch there is narrowing at the beginning of the branch.
You mean the second one above?
Yeah, I try to use the pointer but it doesn't work now. ขอเป็นสไลด์โชว์ให้ผมได้ไหมเอาเป็นหน้าสไลด์โชว์ครับ
Okay.
แล้วก็ผมขอใช้เมาส์คนเดียวเนาะ
Okay. We
ขอ
try
เมาส์ให้ผม
to.
นะ share
Yes.
โอเค
Okay.
ผมไม่เห็นสไลด์เมาส์เนาะโอเค in conclusion for the conclusion finally I have to put one more stent to his coronary artery because there is the new narrowing part of his coronary artery. The previous stent was good. No problem with the previous stent, but the new lesion outside of the stent, there are progression of the disease. So I have to put one more stent, and finally I can finish the procedure. This is the balloon that I put the stent, and then I put the new stent here.
On the second video.
Yeah, on the second video. And we use the two balloons to open both stents at the same time. And so now you can see
the blood flow.
Okay, I will stop and show only one about only two movie. The middle
video, you mean?
the middle video, the above middle is narrowing at the at the beginning part, and there is a
That is
bigger
ah.
here at the pointer, so you can compare with the
I feel like jaw drop. I'm so excited.
yeah
It's like blockage there, very narrow, almost cut off. And after the treatment done,
yeah
after the angioplasty, then the blood flow is go like wider and bigger.
yes.
Wow.
So I success this case within about half an hour.
Oh.
Okay, so I think the time because of the
Because of the time limitation, but actually our doctor, let me say, after we discussed with him, and I also sometimes step into the CAD lab and assist other patients who speak German. I used to help and assist the German speaker patient and stand next to him during his, when he performed the treatment for our patient. But I feel like I would like to share, yeah, even difficult cases. Actually, he prepared 6 cases, but we only have the short period of time. I'm sure that we will have, okay, going to have the second version with you, and I will invite you again back to our program. And today, as you can see from the video and his presentation, but there are many cases that are so difficult, but it can be done, can be fixed, and he talked about 2 or 3 hours, but after that, that patients can continue living. Yes, and you know, we can go back to the first slide. Can we go back to the first slide? Before we go like we gonna lose someone, our loved one, the people in or family member or relative bring him or bring the patient on time, right? Don't think about like a gastric problem. Maybe it's something serious. So to make sure that it's not heart problem, come into the hospital, have the check done, and then you can stay calm sitting at home and believe you're safe in peace, right? And if you have any question or the symptom like doctor explained before, please come to our heart center, Bangkok Hospital, Phuket. You can make a reservation by call 1719 and ask them to connect you to the heart center and come to consult and make investigation and make sure that everyone who are living together are happy and healthy together. Thank you so much, and I'm sure that we will see you again, doctor. Thank you for your time today. Thank you, ขอบคุณค่ะ Thank you, everyone, and stay tuned next week. Which program we're gonna show you next Thursday, 2 o'clock. Stay tuned. We'll let you know. Thank you, and goodbye for today. Thank you. Bye-bye.